Hello, my name is Dr. Raja Adnan Ahmed, and I'm a consultant psychiatrist currently working in UK. And with me is Dr. Aman Arora. A lot of you would already know Aman because he's been doing a lot of medical education activities, running different courses, and has helped a lot of IMGs through their journey into UK through different activities. But this morning, I thought I'll ask Aman about the MSRA exam because this is the time when people should be really reading about this exam and doing some questions because the next attempt, as far as I know, would be around in January for most of the specialties. So I think I thought I'll bring Aman because he's been helping a lot of IMGs with this particular exam, and he has his website has a lot of information on it as well. But Ahmed, would you like to tell us about what is MSRA exam, if I just don't already know about it?
So I'm going to firstly thank you for inviting me on. I think this is a really important topic. A lot of people come to me with questions about MSRA, worries, doubts, fears, and hopefully we can try and cover some of those things today. People feel in the best position to preparation. MSRA, multi-specialty recruitment assessment, is an assessment obviously for a lot of different specialties now. It used to be one that predominantly is used for general practice, but now obviously psychiatry and lots of other specialties are coming on board, using it as a stepping stone. So in some instances, the whole part of their assessment criteria for specialty entry. So it's a super important assessment and one not to be taken lightly.
When you say it shouldn't be taken lightly, so in your experience, you must have seen people making some mistakes. Is there anything common? Are there any common mistakes which you has been noticing?
Yeah, loads. Loads of things that happen again and again and again. I spend time trying to make sure people reduce these mistakes, and hopefully this can help with that. One of the things is very simple. It seems so simple that people leave it too late. Now, as you mentioned, the MSRA is coming up in January. People often kind of think, well, January is next year. It's only in November. I've got so many left. I'll start next week. I'll start next week. I'll start next week. And then when they get to start, they realize there's actually a lot of material to cover because as people know, two completely separate papers part of MSRA, and each one needs a different strategy. And people often sort of a month to start panicking because they realize there's a lot of stuff to get through. So the first mistake I see with this is people just leave it way too, underestimate how challenging the exam is. Yes, people might say after they've passed this assessment from a year ago, it's easy, don't worry about it, you'll be fine, just do a few questions. But when you get down to it, it's a lot of work. So the first mistake that by far people make and then come to me when they're panicking about is they just leave it too short. And people are busy, they have challenging day jobs, they have family stuff to sort out, life stuff to sort out. It takes time, guys. So starting 2-3 months in advance is a very sensible thing.
And any other mistake you've noticed that people are making?
Lots. I mean, I suppose one of the other common things I often people do is they kind of follow the trend as to what everybody else seems to be doing, think that's the way that's best for them. So, for example, simple things like understanding what this assessment is actually looking from you. So there's so many people who are prepared for this assessment and they've never looked at the blueprint, for example, the MSRA blueprint. It talks about what this assessment is, which topics are going to be assessed, how the assessment is laid out, what style of questions are going to come, some example questions on there. So these are free resources that are there written by the people who are going to be writing this assessment. So it's amazing to me how people don't look at that material and actually understand before you start putting in the hours and hours and hours of effort, actually understand what they're going to be assessing me on and how can I tailor my preparation plan accordingly. So the second big mistake is people do not look at the free resources that are there written by the people that are actually writing this assessment. So if anyone hasn't done it yet and you're starting to prepare for MSRA and you're just doing after question, please take time out, go back and look at those resources on the various recruitment websites because there's so much on there that you probably will think, wow, I didn't really understand that. I'm just kind of blindly going through this path of doing questions. So that's the second biggest thing. Make sure you use the resources that are there written by the people who are going to be assessing you.
Okay. And if somebody is thinking about it right now, as you said, January is actually not that far. It's only 8 weeks and we'll be in January.
Yeah.
What should they be doing right now? What are the things they should be doing?
Well, I think before kind of people think about which resources to use, the principle of how to prepare is so important to get right first. So what I see as people do very commonly is we'll sign up to a question bank and just do questions for 2 months non-stop. Clinical questions, SJT questions, question after question after question after question. And that does work in some situations. If you're a person that resonates with these types of exams, yes, the questions is important. But we talk a lot of a dual-faced approach. You need to have a double road in the leadership exam. A single road is just questions. Yes, that will get you so far, but it will leave a lot of gaps. So we talk about the dual approach, where you put a bit of time towards answering questions because your brain has to keep on problem solving. You have to get used to the style that's coming. But the second part of the road is you've got to be building up your background knowledge. You've got to be building up understanding of the principles that are going to be assessed on the day. So for example, when it comes to the clinical effect, spending a bit of time going and reading the guidelines and just understanding a little bit more about the basic medicine that a question bank may miss. For example, a question bank may do a lot of questions on the high yield topics, so you'll understand that well, but there'll be a lot of gaps for what the blueprint is telling you need to cover from what a question bank is going to be able to cover, whether it's 3,000-4,000 questions that are going to. So for the clinical paper, you've got to do background reading, understanding, knowledge building. And from the SJT paper, a lot of people have done an SJT type of exam before. So yes, you can do thousands of questions and understand why those questions are answered like that. Still going to have gaps in terms of understanding principles that go along with the SJT paper, reading things like good medical practice, making sure you're building your base in terms of how these principles are so you can translate them into your answers. So we talk a lot about this approach. And please don't just go and do question after question for 3 months non-stop. Make sure you spend a bit of time. Say, for example, you have an hour's work, set that up, 50-50. Maybe do 50% of that time doing questions, 50% of that time background reading. If you have 2 hours, do an hour and an hour. If you have 6 hours, do 3 hours and 3 hours. You took this 50% split. Some days you may have longer to do than others. Whenever you do, try and have a balance in your preparation. Definitely one of the most important things for MSRA.
And you touched on some of the resources available out there. I think you already talked about using multiple resources rather than sticking to one. So what are the resources that they can use which will be helpful for them to get better scores?
Well, I think for long period for MSRA, it was all about questions. There are lots of different question banks out there, and important to, like I said, keep your brain sticky in terms of problem solving. So there were question banks. There are some people say I like this one, some people say I like this one. Just choose one that you resonate with. Choose one you feel you're understanding really well, one that you're doing not just for the sake of doing X number of questions, but actually understanding what is in those questions. So questions are important. We don't have a bank as such. We have mock exams, but I think they can do a bit more of a time situation. So there are lots of question banks, but also what we try and do is fill the gap with the knowledge. So we have 2 audio courses, for example, one for each of the exams, one for the clinical and one for the SJ. Because as you know, Raja, it's difficult these days to find time to go look online and searching various things. So what we do is put them all in one package, allow you to build your knowledge in one. So there are audiobooks, obviously there are courses out there, but the book comes back to the same thing. Make sure whatever you're doing, it's a dual-based approach. You're doing questions regularly and you're building up your knowledge and principles, and particularly with the SJTs, because SJTs, if you just do question, like I said, you may understand those questions inside out, but when that question comes in a different format, because you understood the background principles and why those questions are important, then you're going to get that wrong. Doesn't matter how many questions you've done about that topic in a question panel. Dual-based approach, yes. I mean, we have different resources that people can choose from, but there are others on the market as well. But the key thing is to have 2 different styles, but also find a style that works for you. So for example, a lot of people learn by audio, some people don't learn by audio. So their books would be for some people, but not for others. Some people like to have a visual course, seeing things on screen. That might work. Some people learn by reading. So you find the resource that works for you best.
When you were already talking about some mistakes, is there any more advice you have for candidates? Anything that you wish they were doing right now and not waiting for the last few weeks?
Well, 2 things. Number one, you've got to aim really high when it comes to that. I see so many people kind of just get the borderline part, as it were, or just hit the score that I know is going to be a comfortable placing their specialty, and already you're setting your ceiling low, kind of allowing yourself to think, well, if I get a question I'm not quite sure about, I'll leave it because I don't have to get the highest mark. So the first thing I would do is, if you start praying for MSRA, aim for 100%, put your ceiling high, so that no one's going to get 100%, no one's going to get every question right. But if that's your aim, then you're going to have 10% extra when you get to a question that you're quite sure about. You're going to put that little bit extra thing on. So one of the common mistakes people do is they don't aim high enough. They just aim to get enough. And when you aim to get enough, subconsciously putting yourself lower, so you're going to let a few marks go. Aim very high. There are X number of questions. All of them have a right answer. There's no reason why you can't aim for every single one to be right. Now, the second thing is people often get very lazy when it comes to MSA preparation. People just do their work, they go home, they sit there for 2 hour questions, and it's a very, you start to get quite dragged down by the fact you're just doing questions on your own all day. So get a little group together, find a study, get 2 or 3 people. These days with social media, you can find people on all sorts of social media streams that are doing the same exam as you at the same time as you. So team up really and have little targets, that by the end of this week, all of us are going to have done this meeting or this many questions. And then you become accountable to other people, choose you a little bit more, and you get that little more done. I often see people just go alone and go slow with MSRA. And like we said, it's a lot of pressure. Your career is an interview, so people put a lot of pressure on themselves. And there's day-to-day work life, etc. And it gets quite lonely. And when you start to get lonely, you start to feel down, your efficiency of preparation goes as well. So definitely team with somebody. You may have somebody already, great. If you don't, go on social media. We have a GP training support group that you can find people on it. Please, someone so you don't feel like it's a long drag on your own.
I think that's an excellent advice, and a lot of IMGs have told me about the difficulty they have reading for MSRA, because when they do their PLAFs, they are usually in the home countries and they have more time. But the ones who are doing MSRA, they are in UK and they're doing these busy jobs. They're already trying to settle in the system. Some of them are already signed up for MRCP and other exams as well. So suddenly when this exam comes on top of them, they find it difficult. But I think it's very important for them, as you said, to spare some time and make a group if as possible. That you can get motivation from them, and also also try to aim high. Not just for a simple pass. Because if you want to go in at a good deanery and you want to work in your degree of choice, it's better to score as much as you can.
Yeah, and also don't listen to negative stuff about MSRA. A lot of people turn around and say, oh, I've heard MSRA is very difficult. I've heard SJTs are impossible. I think I'm going to be able to do that. And they're already kind of putting their level very low. They're listening to other people's experience. Look at assessment. Yes, an assessment, needs a bit of work. You need to do the background work. You need to understand what's being assessed of you. But there's no reason why anyone can't do well in MSRA. You just need the right preparation. You need to be smart rather than just do thousands of hours. It's doing smart work, understanding what's best of you, having that dual approach like we found, not just doing question after question and just going through the run of the mill, as it were, and having a backup and have somebody to pull you through but that everybody who's gone into the study that you're going to, most people have been in MSRA. So it's a very possible assessment. But like any other assessment, it isn't by luck. You have to plan it well. You have to use the resources that are there and efficient with your work.
Thank you, Aman, for your time. I think that was all very useful advice. And if you like to share some of the resources which are on your website, then I'll link it with this video as well. So just in case people want to look at them.
Just a couple of things to mention, guys. If you are thinking about GP training, then have a look at our GP training support group. We do a lot of training on there for MSRA. People build up a lot of connections up to MSRA. So have a look at that. It's just the GP training support group on Facebook. We have a couple of blogs on our website, aurorameducation.co.uk, a couple of MSRA blogs about how to prepare, a couple of Google questions, for example. And then, yes, on the website, we have a variety of different resources that Raja will kindly hopefully put on the link somewhere below, auroramedicaleducation.co.uk.
Thank you. Thank you very much.
Thanks.